Right now, more than 106,000 people in the U.S. are waiting for a life-saving organ transplant. And like so many other aspects of our world, transplant programs were impacted by the pandemic. All new at 6, WCNC Charlotte's Chloe Leshner spoke with experts who are now feeling more confident about who can be a donor.
39,000 organ transplants were performed in 2020. That's after the surgeries came to a screeching halt at the beginning of the pandemic. After dying from COVID complications, 20-year-old University of North Carolina Wilmington student Tyler Gilreath saved others, donating his heart, kidneys, liver, and pancreas.
If somebody dies of COVID, initially in the pandemic, they were almost exclusively excluded from being organ donors. That, however, has evolved.
Transplant teams have adapted, and now, under some circumstances, people who die from COVID or have had it can be life-saving donors. Since early on in the pandemic, every single donor has been tested, and it's more invasive for lungs.
The system remains very safe. People were often concerned about, potentially acquiring COVID as a result of the transplant, and that is a very, very rare event.
Experts say that's made transplant centers more comfortable looking at patients with a history of COVID.
If someone was unfortunately dying of COVID right now, you would have to be much more cautious in the way you looked at those organs, really tried to think about their viability, made sure that there weren't other complications that COVID could have triggered.
Dr. Cameron Wolf works at Duke Health, one of 5 transplant centers in North Carolina. He says COVID is just another factor to seriously consider when determining if the benefits of the transplant outweigh the risks.
The risk is also sometimes not doing a transplant. So, for example, if I have someone in my hospital who's in desperate need of a heart transplant and may not make it through the week if they don't get one, sometimes taking calculated estimates of how you can get that person to transplant, in fact, really works out in their best interest.
Doctors say the COVID vaccine is especially important for transplant recipients, and ideally they should get it before they have their surgery. In Charlotte, Chloe Leshner, WCNC Charlotte.